Joann, it's so nice to see you again. How are you?
I'm good, but I do have a couple of questions. I got some concerns. I have been missing this one tooth for over a year. And I know we haven't talked about this yet, but how do I know if I'm a good candidate for an implant? Because I really need to do something with that missing tooth.
Sure, I understand. Well, there's a couple things we can do. First thing we'd want to do is get a three-dimensional image of that area,
Okay.
so that we can determine whether or not you have enough bone density, height, and width there to accommodate an implant. But it's a pretty simple procedure, and if there isn't enough bone, most often we can go in and place a graft there and redevelop that bony ridge so we can have an implant placed in the future.
Okay, good. And I kind of hate to admit this, but as I'm getting a little bit older, and I have noticed that my teeth are starting to get a little bit more fragile, which really kind of surprises me because I thought I had enough calcium and vitamin D intake, but they're kind of fragile, and I'm just wondering, is there some way I can help prevent them from getting cracked?
Sure. Yeah. Often I'll tell patients about an occlusal guard or a night guard or a bite guard. It's a preventive device that keeps your teeth from banging into each other. You only have so much enamel on your teeth, from an early age, and you don't create any more as you get older. So it just wears down over time, from chewing foods and how your teeth come together. So the most important thing is to protect what you have and kind of prevent and maintain what you have left. And a night guard is the best way to do that.
Oh, okay. So now let me ask you another question when we're talking about cracked teeth. Is a cracked tooth, could that cause bad breath?
A cracked tooth, if it's infected, could. It's the bacteria and the byproduct of the bacteria that generally cause the bad breath. A cracked tooth, you're going to notice pain more so than you would bad breath.
Okay. Now here's one that might be a little embarrassing. When I sleep sometimes, if I roll on my back, I breathe through my mouth. So the dog has not said that I snore yet, so I think it's just the heavy breathing. But it tends to give me dry mouth. Is there something I can do to prevent that?
Yeah, there's a few different things you can do. There's oral rinses, there's lozenges, there's sprays, things that are all kind of temporary. There's things that are a little bit more permanent, little tabs that we can put up in your vestibules or in the cheeks next to your teeth that help produce saliva throughout the day. Another thing that often goes overlooked is people with sleep apnea really don't notice that, but they do have a tendency to breathe through their mouth, maybe snore, maybe not snore, but that in itself dries your mouth out. So maybe it's not really that you're not producing enough saliva, but that you're just sleeping with your mouth open and it's drying out throughout the night. And that's allowing bacteria to kind of colonize your teeth. And so a sleep apnea appliance or a simple mouth guard that repositions your jaw in a specific way can help alleviate that, help you breathe better, get better sleep, and produce more saliva.
Oh, okay. So that kind of sounds like it might be an easy fix for me. Oh, well, that's a little bit more what I wanted to hear. It's sort of scary when you're thinking about all these different things that are going on in my mouth. I had one other thing I wanted to ask you about. Since I do have periodontal disease, being that I brush 3 times a day and I floss once a night before I go to bed, besides my cleanings that I come in for, what else can I do to help prevent, the problems I have in my mouth?
Well, the flossing and the brushing, they only get so far down in and around your teeth. And if you think about it, bacteria are microscopic, and so they get down into all those difficult, hard to reach places. And the bristles in your toothbrush aren't fine enough to reach those areas, and the floss can't get down deep enough in between to get those areas. So there's a few things you can do. I always recommend a mouth rinse, because the fluid is gonna find its level in those deep, dark crevices and help flush out that bacteria. But the use of a water pick is also very important when you're trying to keep those pockets clean. You can also use these little interproximal brushes that are much more effective than floss in between your teeth. They kind of look like a little Christmas tree or like a little pipe cleaner that gets in there and that gets around the curvature, the convexities and the concavities of your teeth below the gum line that help flush out bacteria. Diet is also very important when you're talking about periodontal disease. You want to reduce the sugars that you're taking in to your mouth reducing sodas, reducing anything that has acid in it, like coffees and teas, that can really wear away at your teeth and just exacerbate any conditions that you have in there. Drinking water more frequently throughout the day helps wash your teeth and kind of help your saliva flush that bacteria out of there to keep the pockets clean.
Oh, well, thank you so much for giving me that information, because I am a tea drinker, so
Sure.
that was good news.
It doesn't mean you can't ever drink tea. I love coffee. I drink coffee. It's important to remember to just kind of rinse your mouth and flush it out with water. Drinking water routinely helps reduce those acids and those sugars from sitting on your teeth.
So after I have my cup of tea, then in the morning, which I usually like to have, then just maybe drink a little bit of water right afterwards, or would that help?
That's correct. Yeah. Anytime you're drinking soda, coffee, teas, anything like that, the last thing you want to do is go and brush right away, because all you're doing is scrubbing those acids and those harmful chemicals into your teeth. Whereas you want to rinse with water and allow that to flush off your teeth before you clean it.
Oh, see, I didn't know that either. I would have ran right to the bathroom and brushed, so that's good to know. Oh, great. Well, at least now I know I can still drink my tea. The cracked teeth and everything else. So it's just simply, I just really need you to kind of take a look today and see what's going on and let me know what else we can do.
Sure, we can do that for you.
Good. It made me feel a little bit better. I was a little bit worried about it because I've got so many things. Like I said, I'm getting a little bit older, and it seems like your mouth sort of starts to fall apart like everything else does. So I don't know. So, yeah. Well, thank you so much. I feel really, really good about it. I'm going to sit there and let you take a look, and then we'll go from there. Yeah.
That sounds good.
Thanks.
You're welcome.
Give us a call or go online to schedule your appointment with Bellissimo Dentistry.